Cervical intraepithelial neoplasia is a precancerous condition in which the abnormal cells grow on the surface of the cervix. Women who become infected by the high-risk type of HPV such as 16, 18, 31 or 33. HPV type 16 or 18 produces E6 and E7 protein which induces the expression of the cellular P53 and P110 or P oncogenes respectively. Women who are immunodeficient, women who give birth before the age 17, smoking cigarettes, having sex with multiple partners, becoming sexually active before the age 18, becoming infected with the human immunodeficiency virus, poor socioeconomic status, multiparity with a poor birth spacing between the pregnancy and a poor menstrual hygiene. Signs and symptoms. There are no specific symptoms of the cervical intraepithelial neoplasia alone. Symptoms of the cervical cancer, abnormal or the post-menopausal bleeding, abnormal discharge, changes in the bladder or the bowel function, and the pelvic pain on the examination. Since cervix may transform into the invasive carcinoma in 10 years. Diagnosis. Pap smear, colposcopy to examine the cervix and surrounding the structures. A biopsy may be performed to remove the tissue samples for the examination in the laboratory. A DNA test may be ordered to see whether a high-risk form of the HPV is present. Cytoplasmic vascularization and the nuclear enlargement of the cells is seen as a histologic features in the HPV-related cervical intraepithelial neoplasia. Removal procedure include loop electrosurgical excision procedure. Uses a small electrically charged wire loop to remove the tissue. Remove the tissue samples for the further analysis. Complications following the procedures are the delayed bleeding, narrowing of the cervix, or stenosis. Cold knife cone biopsy conization. This is a surgical procedure in which the cone-shaped piece of tissue containing the lesion is removed. Conization can provide a sample of tissues for the further testing that are used in the grade 3 with no colposcopy. Higher risk of complications including the cervical stenosis and the post-operative bleeding. Hysterectomy, the aged female with a grade 3 sin. Sin grade 3 followed by the pap smear should be confirmed by the colposcopy directed biopsy. Ablation and the resection. Effective is about 90% of all cases, with a 10% chance of recurrence often seen after the treatment. Patients are advised to have a follow-up pap test every 3 to 6 months for 1 to 2 years after the treatment. Seen to have the risk of the pregnancy at 5%. Seen grade 3 followed by the pap smear should be confirmed by the colposcopy direct biopsy. Treatment of choice of stage 3 seen in the hysterectomy. Time taken for the conversion of a sin cervix to the invasive carcinoma is 10 years. Cervical intraepithelial neoplasia 3 with no colposcopy activated treatment of the choice conization. HPV-related cervical intraepithelial neoplasia can be diagnosed by the presence of the cytoplasmic vascularization and the nuclear enlargement of the cells. Human papillomavirus is most commonly associated with the cervical intraepithelial neoplasia, grade 2. Cervical intraepithelial neoplasia associated with the previous viral infection shows E6 and E7 protein. Abnormal cervical cytology and the pap smear suggestive of the SIN3 should be managed with the colposcopy and the LEEP. Treatment modality in the SIN patients can be cryotherapy, LEEP, and the full life conization.